And I know that you have all these like backgrounds, coaching, licensed social worker, to try to help the patients in many different ways that sometimes we can't just as physical therapists, right? So from your background as a licensed social worker, what did you learn that you think it's important for PTs to use that to try to help their patients in different ways, either referring, identifying signs of abuse, or how can we use that in simple ways on our day-to-day practice to help these patients?
That's a great question. I think that it starts with educating ourselves so that we understand, for instance, the adverse childhood experiences, the 10 things that can happen to people as a child that affect them later. And then I think it's probably the most important thing is to create a safe relationship and a safe space for that patient because they a lot of persistent pain can be there because of a past threat. And although and I think that other people on your podcast have spoken about this, but even if the threat is no longer present, then that person's nervous system still sees that. And until that's processed in a very safe space, it's not going to go away. And so what we see as maybe resistance or odd behavior isn't odd at all when we consider what that person's been through. And that's another thing is a willingness to have uncomfortable conversation with our patients. I remember several years ago, we in our hospital clinic at that point, decided it was important to ask the patients if they had any mental health issues. I guess that was the main thing. And the therapists were reluctant to do that because, we don't have training in that realm. And I didn't either, except for the coaching. But I found that patients were very willing to talk about that. I think they were reassured that someone cared and would ask. And it didn't go on and on like you might imagine, because I know we're busy, and so you get a talker, and that eats up your time. But so for PTs, I think that willingness to just ask and be open. And if someone doesn't share right then, if they see that we're truly creating a safe space for them, then they might share later. And then we can help them understand that they may need another kind of therapist. They may need to see someone about their trauma or whatever has happened to them.